Assalamualaikum warahmatullahi wabarakatuh. So today our group will present about occupational respiratory disease, or we call as ORD, focusing on industrial sector.
For introduction, why we selected construction industry? Because the construction industry is a crucial and progressive sector that support economic structure and development of urban area globally. However, it remains one of the most hazardous sector for human health, as the construction worker usually work in high intensity work for extended period of time in unpleasant atmosphere. Moreover, the reason made the construction industry one of the most hazardous industries in the world because of the rapid economic development and national growth. For this reason, construction workers often experience hazard risks throughout the construction process due to dangerous working environment at the construction site. Construction sector is the industry sector that is extremely hazardous, with the highest number of accidents recorded in most countries worldwide. Based on the International Labour Organization (ILO) data, occupational accident and disease recorded more than 2.7 million annual fatalities and roughly 374 million non-fatal work-related injury (illnesses) worldwide. Okay, next, occupational respiratory disease. What is ORD? ORD is lung condition caused by inhaling harmful dust, chemical, gases, or biological agent in the workplace, which can develop airway obstruction affecting pulmonary parenchyma, where lung volume will reduce if exposed for a long time. Conversely, from common respiratory illnesses, conditions like persistent cough, wheezing, or shortness of breath visibly occur mostly during work shift. This condition will improve after a period away from work. Occupational respiratory disease is a primary cause of work-related sickness and mortality worldwide, as approximately 1.9 million people die every year from job-related respiratory illnesses, according to the WHO. Respiratory disease also can be influenced by socio-demographic factors. For example, age, race, gender, level of education, medical illness, and smoking habit. Occupational factors also influenced by level of exposure to respiratory hazard in the workplace, such as duration of working hour per day, duration of employment, type of industries, and specific job roles.
Now moving on to the data analysis. Our data are obtained from the Registry of Occupational Disease Screening, or RODS database 2023. This study is collaborative database by DOSH, MOHD, and UITM. As mentioned in the introduction, we are focusing on construction industry in Selangor, Melaka, and Pahang. So the target disease of this study are suspected occupational respiratory disease, or we call as ORD, and the disease occurrence or prevalence is 12.1%, which is 51 cases out of 412 of participants met the diagnostic criteria, which is at least reporting one of the symptoms of ORD, such as cough, shortness of breath, and phlegm. Now, I will conclude to you about the significant trends and risk factor of ORD development among the workers in construction area. The most significant predictor is the workers that never use N95 masks during their work process has increased their disease risk by 9.35 times higher than others. And the second one is the dust exposure, or working in the dust environment, has increased the likelihood of ORD by 4.93 times higher. And then lastly, the workers that have comorbidities like diabetes, hypertension, or heart disease were 3.68 times more susceptibility in developing ORD. So why is the factor of never use N95 mask poses higher risk for the workers? It is because we also know as the construction site as the workplace that full of dust and hazardous particles. Thus, it can poses higher risk for the workers to develop ORD.
I am SHAHIRAH. Now we are moving forward to the next slides, which is high-risk groups. In this study, there highlights that the most vulnerable, that two factors that may contribute to the occupational respiratory disease known as ORD in Malaysia construction sector. As I mentioned before, there are two main groups that we need to be focused more, which is based on their health conditions and also their lifestyle. For health conditions, it shows that about 10% of the workers have comorbidities, specifically diabetes, heart disease, and also hypertension. This group of workers were presumed to have higher likelihood of suspected ORD. Comorbidities also may lead to the respiratory impairment and cardiovascular problem. Next, workers' personal habits, especially in bad habits such as smoking and vaping, may also contribute to the ORD disease. Surprisingly, the data states that e-cigarettes and vape users have 2.53 times more likely to develop ORD. However, we need to consider alongside other relevant factors that may contribute to the ORD. We need to be more focused on this group because they have specific health profiles and also personal lifestyle. Now, here are the most critical hazards found in construction industry. First and foremost, daily exposure to the dust, commonly cement dust, ground dust, and not to forget toxic fumes. These particulates may damage the respiratory system and may lead to the chronic obstructive pulmonary disease. Based on the study, it also stated that about 5 times likelihood to increase the suspected of ORD. Due to the dust exposure, workers are required to wear personal protective equipment, specifically N95, while doing their work. However, there are few workers refuse to wear it. The study shows that the workers who fail to follow the order have 10 times to suspected ORD. Therefore, the employer should think new effective control measure and also become more strict about the order in the workplace.
Here, we highlight the prevention, control, and treatment strategies for respiratory diseases in the workplace. For prevention, the focus is on awareness campaigns that use simple language and visuals, routine screening such as lung function tests and vaccination, and workplace measures like PPE enforcement, ventilation, and dust separations. Moving to control strategies, this includes surveillance systems to track cases, engineering controls such as ventilation, dust collectors, and air filters, as well as administrative measures like rotating shifts and reducing exposure time. Legislation and enforcement also play a key role in ensuring the compliance. Finally, the treatment strategies involve medical care with options such as bronchodilators, corticosteroid, and antibiotics. Pulmonary rehabilitations and counseling help workers recover, while telemedicine and diagnostic imaging expand access to care. Importantly, equity in treatment ensures that all workers receive support regardless of location or job.
So next, we're going to move to communication approach for non-technical audience. To ensure that the information on occupational respiratory disease is easily understood by workers and management, we use a communication approach designed for a non-technical audience. Firstly, we use a simple and clear language instead of complex medical or epidemiological terms. For example, occupational chronic respiratory disease were explained as long-term breathing problem caused by exposure to dust, pesticide, and other harmful substances in the workplace. In addition, visual aids such as charts, infographic, icons, and workplace image were used to present disease trends, high-risk groups, and risk factors in a more engaging and understandable way. This visual helps simplify complex information and make it easier for the audience to remember a key points. We also focus on practical prevention message such as wearing appropriate respiratory protective equipment, attending regular health screenings, reporting respiratory symptoms early, and following safe work practice. By using simple language, clear visual and practical recommendations, we aim to increase awareness, encourage preventive actions, and support better workplace health management among workers and employees.
In conclusion, occupational respiratory disease or ORD remains a major health concern among the construction workers due to the continuous exposure to dust and other airborne hazards. The study identified dust exposure, inconsistent use of respiratory and existing health condition as the main risk factor. Therefore, effective prevention through the engineering control, proper PPE, regular health monitoring, and worker training is essential by combination of epidemiological evidence with clear communication and continuous monitoring. Employee can reduce the respiratory disease risk and create a safer and healthy workplace.